at the Edwin S.H. Leong Center for Healthy Children. It's my pleasure to introduce you to our speakers today. Dr. Angela Mashford-Pringle is an Algonquin ikwe from Timiskaming First Nation, Bear Clan, and an associate professor at the Dalla Lana School of Public Health at the University of Toronto. Her research examines Indigenous pedagogies and praxis on environmental and climate health, Indigenous cultural safety, and Indigenous women's health through social systems. Dr. Amy Shawanda is Anishinaabe Kwe from Wickwamekong unceded territory and the inaugural director of research at Kanjge Wingteg. Her research has examined Anishinaabe motherhood's challenges and strengths, Indigenous child welfare involvement on the health and well-being of children, and Indigenous methodologies and pedagogies. Drs. Mashford-Pringle and Shawanda were recipients of the Leong Center's 2021 Catalyst Grant Competition and will be presenting on that research with us today. And with that, I will hand it over to our speakers.
Okay, Miigwech, just pulling up the slides. I want to make sure everybody can see them.
That's perfect. We can see it.
Awesome. So today we're going to talk about the research that we did together. And it's a long story, but it comes from a lot of knowledge of our communities that child welfare is a huge issue. So thank you, Ellie, for introducing me. Traditionally, we would introduce ourselves so that everybody knows who we are. So I'm the mom of 2 adult daughters, one who's in her PhD at U of T and the other that's finishing up her undergrad at U of T. And I've been married for 30 plus years. I have 2 fur babies. Hopefully they stay quiet while we're presenting today. And I have been working in the areas of Indigenous health and education for 30 plus years. So that's a little bit about me. I will tell you that from our traditional teachings, we would, if we were probably in person, I would have smudged to start us out, even if it was for Amy and I. And this is just our way of grounding ourselves and connecting ourselves to spirit, but it also helps to cleanse the room so that we make sure that we're talking in a good way, listening in a good way, thinking in a good way, and coming from our heart and being true to ourselves. I'm going to turn it over to Dr. Wanda.
Hi, everybody. Miigwech for having us here and coming to listen to us talk. I'm Dalla from Wickwamekong, situated on Manitoulin Island, which is situated in Lake Huron, which is ideally, people like to call it Northern Ontario. Trust me, we are not Northern Ontario. Thunder Bay is Northern Ontario. And so with that, I also have a diverse research portfolio, and we also have, I guess, following Angela's lead, I am a mom of 3. I have 3 children, 2 boys and a daughter, and they all are very diverse in their ages, and my oldest being 16. So, it's been such an interesting journey going through just constantly talking about our experiences. And I think when I connected with Dr. Mashford-Pringle or Angela, I really was thinking about my work in Anishinaabe motherhood. And with that, thinking about my own family history, and I say this quite often, that I come from not so much a lived experience, but maybe perhaps a lived experience in the way we're going to talk about intra-generational trauma later on, but more so this experience when talking about it was looking at my dad's side of the family and seeing how child welfare has really impacted. He is a child of the system and later adopted, and seeing how those intergenerational traumas have and healing has taken place in our family. So with that very brief introduction, I will hand it back over to Angela.
Thank you. I shouldn't put myself on mute because apparently I don't know how to get myself back off. Actually, Amy, this is still you.
Oh, okay. So kind of coming back into that story about my family, talking to about Indigenous parent stories of child welfare, I was talking to Angela about how my my own family had being a mom, an Anishinaabe mom, that in the back of my mind, I'm constantly thinking about child welfare. And it's something that sits there in the back and it just feels like I'm constantly being policed, not by myself, but like it's a real threat and fear that I have, even though I'm educated, I hold a doctoral degree, and my kids are raised to all the standards we meet in the Western standards, but that fear that sits back there is very prevalent in my life. And, you know, even accessing healthcare, I'm always like, I need to dress up. My kids need to go, even though they're sick. I'm like making sure they look their best when we're going running out the door. And it's because of historical that historical lineage of people policing, and I'm scared of my child might be apprehended, and having conversations with my families and friends about these things, that these stories of Indigenous child welfare really looks at gathering those stories. And coming off my PhD, parents would talk a little bit about that, but they never really delved right into it. And so we aim to gather Indigenous parents, guardian stories about contact with child welfare system in Ontario, and really capturing their experiences and perspectives, and government responses related to those child welfare practices and policies. So that was kind of telling my mom this story and the research we're embarking on. Really, I was asking her, how do we talk about that? And she said in Anishinaabe, and it's Wanaje Wini. Oh, somebody's thing popped up there. Nojmowayan, and that is the path that is taken to heal together, taken to be together. And so that is essentially what this project was doing.
Thank you. So with that being said, we want to give you a little background on Indigenous child welfare. Right now, I know these statistics are old and I'm sure that there's newer ones, but this is where we started from, that we represent about 7.7% of all children living in Canada under the age of 15. And as Amy just said, she's got two that are under 15. And we represent 52.5% of children who are in foster care. That's in foster care. That means apprehended. That doesn't mean that they're just into the system. And we've heard from the stories that we're going to talk about, that number is probably around 70 or 80% of Indigenous families have some connection to child welfare, whether it's ongoing or it's happened or it's happening. We know that this is a very huge issue. We have just recently, we have just recently, looked at all of this as we were completing the papers, and I can tell you that one of the biggest issues that we were facing was around what the parents and the caregivers were telling us in terms of what they were getting social workers, even in the Indigenous child welfare organizations, that weren't culturally competent. And they were hoping that service providers would do something about that. And there's a huge need. And we'll talk more about this, but there is a huge need for that. And while birth alerts, Amy, I don't know if you want to chime in a little bit about birth alerts, but birth alerts are a huge issue and have been for many generations now.
Yeah, I can just.
Sorry, go ahead.
Birth alerts are when was the last call again, Angela, in Ontario?
2024, as far as I know.
So my daughter was born in 2021, and when that was happening, and I was already starting to see some news articles come out about birth alerts and the problems with it, and to experience it myself to a lesser degree, I would say. I was in the hospital just giving birth to my daughter, and the nurse had said, is child welfare in her case? And I just given birth, so exhausted. I just kind of looked over as I'm going to put a mental pin in this for later, and I'm going to address this later. I just can't take that on right now. And then the other nurse said, no, as far as we know. So she was going to double check to see because I was visibly presenting as an Indigenous person. So that real fear of you know, having this kind of, again, come back in my life, was, I never had it with my two other ones, my older ones, but this one was like, that was a shock. And being as educated I was at the time, I got actually scared I was going to lose my daughter in that moment. And so that is a real fear. And I'm just thinking, and bringing that story to Angela when we were starting this, I was like, you know, how many other parents are going through this? How many other parents that we don't even know? And that's kind of also partly where this research came out from.
So birth alerts, just so that you're aware, what happens is if you present as an Indigenous person, visibly Indigenous person, or your healthcare provider knows that you're Indigenous, they can queue up through the child protection agencies, not necessarily Indigenous, that you are going to give birth. So it doesn't matter how you get into the system, but a birth alert happens when you get to the hospital and you go to have your child. They then re-inform the child welfare agencies that you're there to give birth, and they will be there within 24 hours of you giving birth to take your child. This is, I mean, the fact that it's 2026 and this just stopped in the last couple of years kind of shows you the bigger, broader issue that was going on in terms of child welfare and how many of our children ended up in child welfare. While the governments have told us it's ended, we're not 100% in belief that it's totally ended. So that's why Amy was saying it that way. And I just want to mention that you don't have to be having mental health issues, substance use issues. It may be that somebody, if you have another child and you've been, you know, your child has had any issues at school, the school may have informed the child welfare agencies, who then ask the hospital to give an alert knowing that you're pregnant. Your primary care provider might know that you're going through a phase where you're not housed, or you're precariously housed. We tend to have a lot of couch surfing in our communities. And when I say that, it's not because they can't afford somewhere, it's because they want to be with family and there's nothing near their family to live in. And we'll get more into that too. So birth alerts are a huge issue in our communities. And we know that the Truth and Reconciliation Commission mentioned the child welfare system in their final report and in the calls to action, because the child welfare system becomes an extension of the Indian residential schools. The goal of it is to assimilate us. If you take the Indian away from the parents, then you get to kill the Indian and save the child. That was the rule of residential schools, and we're seeing the same thing in child welfare, because they're saying there's not enough Indigenous foster parents or homes for our children. And so they end up being in non-Indigenous families who either don't have the time or the resourcing to find out what it means to foster an Indigenous child. And so the child doesn't get anything with their culture and language, or they have no connection. One foster parent that we talked to also said that it was inconvenient with the family, the Indigenous family, asked for a visit. So these are things I just want to put in your head about the current times.
Dr. Mashford-Pringle, I'm not sure if you noticed the slides are not currently sharing.
Oh,
so you might want to just
hold
flip those back on. Thank you.
No, I did not notice. So, they flipped off. Of course they did. Are they sharing again now?
Yeah,
They are.
got there now. Yeah.
Okay, perfect. Yeah, I wasn't sure what happened because it just all of a sudden I could only see me or see the screen. So now that we think about today, this is a huge case that happened in the last, well, as you can see, 20 years basically. The Assembly of First Nations and Dr. Cindy Blackstock, who's an alumni from the University of Toronto, submitted the Canadian Human Rights Tribunal complaint about child welfare. And specifically, she started out because of Jordan River Anderson. And he was a young child. He was 5 or turning 5 at the time of his death in Manitoba. And they wouldn't pay. So the province of Manitoba was fighting with the feds about who should pay for his special needs medications and the things he needed to go home. One of which was a respiration machine that he needed, and then he needed a special shower because he wasn't able to, like, he didn't have the physical skills to be able to shower himself. And they started fighting about this in 2004, and he never got to go home. In the 5 years of his life, he lived in the hospital, and he passed away in the hospital due to his health issues. And so part of this going in was so that we could start to make sure that the federal government and the provinces didn't fight about who was responsible for funding First Nations children to be able to be in their homes and getting the care they needed, which is why we got Jordan's principle. That's what Dr. Blackstock was fighting for. But alongside that, at the same time, child welfare has been an issue since the 1950s. And so she was also fighting to make sure that we had more control and more funding for child welfare, because we are up until, well, I could almost say including now, the federal government wasn't paying out as much for Indigenous child welfare as it was for non-Indigenous child welfare. And based on the numbers, that means we're getting less services. We have overworked social workers. The whole system isn't funded in a way that's conducive with the numbers that we have. So she files this in 2007. There's a ton of appeals between 2008 and 2013. They find in favor of the AFN and Dr. Blackstock in 2016. And in 2017, Jordan's principle is implemented. And with that, that means communities got some funding to help families to do a whole bunch of things. And I think, Amy, you were going to chime in here about that.
Yeah, so Jordan's principle, as great as it's been, it's also very here in Ontario, we got the JP got inundated with requests because the need was so great. And we also see that in certain areas that, you know, in my community, just specifically my community, looking at that, we were able to access, the community was able to apply for big funding and get it, which was great. And we can access that. But there's also misconceptions about who qualifies for that and what qualifies. And so there were different things that were going on, but also, you know, my 16-year-old, we live off reserve, and we kind of fall through this unique space, or the cracks, if you will, that we're not able to access a lot of things because we live off reserve. And so when people are, you know, his school was saying like, oh, you can access things from your band. And I said, but that's great because my band's telling me I can access things off reserve. And so it's kind of, again, not to use Jordan Anderson, but like we fall like, no, you're going to do that. No, you're going to do that. And we're just like, okay, well, where do we go? And oftentimes people say you can access things through the Friendship Center, and we can't access the Friendship Center. A lot of people say you can access things through AHACs, which are Aboriginal Health Access Centers. We don't have one here in Peterborough. And so there are very limiting in services that we can access. But again, it's just like everybody's pointing the finger in where we can go. So I'm always trying to advocate not only for my own family, but also for others out there. So yeah, I'll pass back to you, Angela.
Thanks. So the Canadian Human Rights Tribunal, it was a significant win. It was going to be significant, a dollar amount, well over $30 billion over the course of 10 years that was supposed to be implemented and sent into our communities. And the government appealed in 2021. They've continued to appeal, by the way. And as of 2025, they reduced the funding going to Jordan's principle. We'll talk about that more in a few minutes. But I just wanted to show you this because think about 20 years, that's a child's life, right? So if you think about right now, the children that needed the funding that Dr. Blackstock and the AFN put forward, they're adults now, possibly having their own kids, and the system's still broken. So it's something that we have to think about. The other thing that Amy and I were talking about before, personally, when we were setting up this project, was the idea that at least 53% of all First Nations people don't live in reserve, like in community. And so housing's a problem there because we don't have enough housing and there's not adequate housing. And So like all of these things are happening, and that's also contributing to the child welfare issues that we're hearing about and seeing today. Which brings us to what has been happening in the last 6 years. I will tell you that even though we looked at what was happening pre-2020, we went way back, by the way, way back to the 60s. And yes, there's been some great inquiries like the Kimmelman inquiry in Manitoba in 1965 and the Indian Child Welfare Act Commission in Ontario in 1965. And both of them were saying that there's in 1965, right? Like this is a long time ago, there was an inordinate amount of Indigenous kids in child welfare. And they were saying back then that they needed to separate the Indigenous kids, or their words, Native kids, from child welfare because it was such a growing problem. I also want you to remember in the 60s, the residential schools were starting their slow close down. So in all of the provinces and territories in Canada, we were starting to see kids who had never lived at home, parents who had never watched their own parents parent, and communities who had had cycles and cycles of violence happen to them and on them, and as individuals and as communities, all of a sudden having their kids in community without the residential schools, this also caused a problem. Or in the case of my mom, she was born in 1950. And back then, if you were an Indigenous woman and you were giving birth and you weren't married, they would automatically scoop your child. And so my grandmother had the presence of mind, if you will, to put her with her sisters, so with my mom's aunts. And so she lived the first 6 years of her life with her aunts and their families because they already had kids, because my grandmother was down in the birth order. So, she just blended in with her cousins. And why am I telling you this? Because I think that still happens. We'll see that happen just so that people can avoid child welfare systems. So bringing us to today, we have Bill C-92. This was introduced, I think, in the 1990s after the World Children's Summit in 1993. And it's taken this long for it to become to fruition. And even now, while it says some nice, pretty language, there's not necessarily enough Indigenous people or communities who are actually taking this up, because we can make our own laws, and we can make them so that they override the provincial laws. The problem is, I don't know that our communities are large enough or working together enough to do that. I want to dream that we are, but I'm pretty sure that some of our communities have so many fires going on right now that this is not the fire that they want to put out. They're happy to take it over and try to fix it, but at the same time, we should be looking at laws, and I don't think that that's happened yet. So
Also, just to
go ahead.
quickly add, Angela, that also Bill C-92, as Angela mentioned, that her mother was, or someone in the family was removed. Also, that when we were seeing this happening during this time, my research with the Robinson Huron also showed that when these families or the mothers or married out or were taken out, those wives and mothers were trying to live as close to, in proximity to their First Nation. So you will see like these little towns right outside of our communities, and that was so the families can stay close to home. But because they lost quote unquote their status, they were still very much able to just still live in the proximity. So they have that family support, which we're not really seeing today in as urban Indigenous people.
Absolutely. And so while there's funding, the funding hasn't been sustainable. Like, it hasn't stayed the same even since 2020. As you know, we were in COVID when this rolled out, so it really put a damper on how it rolled out. Communities were dealing with an emergency, and I work with another group of scholars looking at pandemic preparedness at UBC under Dr. Kimberly Hooser. And I would say that that has taken over a lot of communities' time and focus, is that. And now that people are starting to look back at like, what do we need to do? Communities are starting to look at child welfare. But again, it excludes anybody that's not living in their community, and it's definitely not reaching to Métis in the same way. So I would hazard a guess that there's more that needs to be done at provincial levels that don't look at the reserve system, but rather are looking at people that are living in urban systems. And so we should have Indigenous Child Family Service laws, because the indicators for apprehension don't necessarily make sense for us. And they should be unique and different for Indigenous children. So, which brings me to family. And yes, this is a picture of my ancestors, if you will. We're not nuclear, so we don't live the way that you see today's families live. In fact, I can tell you, growing up, my aunts all lived pretty much within 10 kilometers of my parents, and I could walk to them. And yes, I lived in the city. I lived in Toronto. And I know that when I was young, one of the things that my mom and my grandparents told me was the reason she moved to Mimico was because it sounded Indigenous, and she thought that that meant there would be more Indigenous people, which there were. Same with Etobicoke. It's an Indigenous name, right? So you'll find that if you go back a couple generations, that we were trying to find ways that we live together. So I lived in one sixplex with my parents, and my aunt lived in another. There were 6 buildings together, and she lived in another sixplex right across the parking lot from us. I had an aunt that was like 2 kilometers from my house, and about a half a kilometer from her was another aunt. And we just all kind of lived in the same area. So you can walk to any of my aunts and uncles' houses for the most part. And that allows us to still continue some of the things that we would do if we were living in community. So imparting language, imparting culture, deciding when you're going to go harvesting or hunting or fishing. Those things you could do collaboratively, and then get in a vehicle and go together as a family. Even if it's not your parents and a child, maybe it's your aunts and uncles taking you, or your cousins are taking you, because we do really value having family around us and how each of us helps to raise a child. So I'm sure you've heard the phrase, it takes a village to raise a child. That's exactly how it works when we're living in our communities, whether it's in the city or it's when we're living in the reserve. I will say that we try very hard to keep everybody together. Okay, so let's fast forward to 2026. My particular family, which means my kids, my own cousins, my aunts and uncles, have all dispersed because Toronto and the GTA has gotten too expensive. And that's what we're seeing about younger kids who are coming out of our communities, or their parents have always lived in the city. They can no longer afford to be close to their parents or their siblings or their aunts and uncles. And so it's making a huge difference in how we see family and how often we can do things together, including ceremonies or any of our cultural activities. And it's changing the way that we can transmit culture, language, and ways of knowing. And that's what we're really trying to impart here, is that we look different. Meaning I have some close friends of mine who, while their kids were growing up, they would take their kids out for all of October to go for the hunt. And schools don't like that. And guess what happens? Child welfare gets called just because they're doing traditional things, but we live in a city and they don't like it in the city. So again, how do we remedy this is about how we teach Canadians to look at Indigenous families. So that leads into language and culture, which I was kind of talking to there, but they're foundational for us as Indigenous people. I don't know a First Nations, Inuit, or Métis person that wouldn't say that language and culture are intertwined and are part of who we are and how we see the world. And so with that, if children aren't exposed to our culture and our language, which if you're living in a city, it's even harder to do, then they're going to learn through the language that gives them the worldview. So there's lots of research about this. And the findings are basically when you learn your first language, it's the language that tells you what your values and beliefs are. So if we're not trying to even put in some words, so we've put a few in the slides today, but not a lot, but Anishinaabemowin, both Amy and I share that as a language because it's a large language group with many dialects. But if we spoke, we can speak in our own dialect and we should be able to understand each other, even though the words would be slightly different. And so you could have language classes. I know growing up in South Etobicoke, the problem I had is the language classes were at Florence Spadina at the Native Canadian Center, and I lived at Islington and Lakeshore, and the class was 9 a.m. on a Saturday morning. And back in the 80s, we didn't have streetcars and subways that ran that would get me down there on time for 9 a.m., which would have meant I had to leave Etobicoke somewhere around 7 in the morning. So why am I telling you this? Because things haven't changed. Take a look at our transit systems. Take a look at where things are offered. All of the Indigenous services in Toronto are offered in the downtown core. So if you don't live near that, the chances that you're going to be able to get your children into anything where they're going to learn this get harder and harder. And that's what we're trying to tell you. So part of this is about being self-determining, right? Deciding that you want your children to have this is great, but if you have no governance over it, so you have no way to ensure that it's equally spread across provinces and territories, then no matter how much we try, even if families do give some culture and language, there's no way within urban settings for us to do that. And there's nothing helping that along. Which brings us to the study. So Amy, do you want to talk to this a bit?
Yes, I can talk to this. So these are our partners that we circulated our posters in recruitment for our Indigenous parents to share their stories. So we have Thunderbird Healing Lodge Society of the Elizabeth Fry in Toronto, Native Women's Resource Center, and Aboriginal Legal Services. So these community partners were really instrumental in getting the posters out, which was really great. At first, I would say maybe the first week I didn't get anybody, which was understandable. People were like hesitant. And then thereafter, which was in April, I began booking rather quickly with participants that want to share their story. And my method of collecting data was I wanted to get this is heavy. Like this, like even recapping all of this is heavy. It's heavy on the spirit, just knowing like hearing the stories day in and day out. I was booking 2 to 3 participants per day and really trying to get their stories. Whereas then I had to slow down and get 2 stories a day, morning and in the afternoon. But that would really wipe me out because I'm trying really hard not to cry when they're telling me stories about their experiences with the child welfare agencies. And so what I would do in the beginning was take half hour to an hour and just really get them comfortable talking to me. And I would share a little bit about me and we would just kind of go through exchange. And then we would launch into the story, into the interview or the kitchen table style. And we would just talk and I would just like, whatever you want to share comes to you. And I was just trying to make that as much as a safe space as possible for them so that they were able to just share what they wanted. And once I did that, we gave it back to the participants and said, like, is this what you want? Did I capture this correctly? And they would bring it back. And that a lot of them said it was heavy and that they didn't want to read it again. Like living through it was enough. And so they don't, so they're like, whatever you have there, I trust that it's fine. So just taking that I was able to build that trusting relationship with everybody. But it's been heavy. And I often think of those families, even long after the study that I left, departed from U of T when I completed my postdoc, that I still had families reaching out and wanting to know, where else can I get help for this or that? And they were asking for legal advice. And I was like, I can only refer you back to our partners at Aboriginal Legal Services. I'm not a lawyer. And I was inundated with requests months after this was done. And so I think that speaks to the level of what needed to be done and what continues to really exemplify what needs, there's a further need for these families. I'll pass it back to you, Angela.
Sure, thank you. So Amy did the bulk of the interviews. I did do two. We did them as kitchen table talks. So if you're unfamiliar, it's like an interview, but we do it more conversational. So instead of like trying to poke you with a question, we listen to what you're telling us, and then we know what our questions are, and we try to get you to talk to those questions. And that makes it so that it's more conversational, which means you hear different stories than you would hear in a semi-structured or a structured interview. And we did all of this between April and June because we were trying to get the data collected so we could do the analysis. Little did we know that Amy would be getting a job within the next 4 months after we did the data collection, but that's exactly how it went. Right now, so if you want to take a look at numbers, we had 18 First Nations and 2 Métis. We had no Inuit representation whatsoever, but that is not surprising because the Toronto Inuit community is just starting to expand. There are about 5,000 to 7,000 Inuit living in Toronto, and we were sticking to the Toronto area. We find it interesting that we had 17 women and only 3 men who responded and gave us interviews. That's not to say that men aren't involved, but they didn't present as being as involved as the women. That doesn't mean that men aren't interested in child welfare, especially in the Indigenous community, where we're doing lots of programming around fatherhood and what Indigenous masculinity is. In fact, I have one of my DRPH students, Cheyenne Joseph, that's exactly what she's looking at, is how do you deal with your masculinity as well as being a father. And so I think that that's telling, though, that in Toronto, we only got 3 men. It wasn't closer to a mix of people. We also put in their interaction with child welfare. So some of them had been apprehended as children themselves. And then we had some caregivers who also had been apprehended as children. And so the foster parents and the grandparents and the parents all had some relationality to that, which means you're starting to see the cycle of child apprehension happening from, parent to child to grandchild to great-grandchild. And even one foster parent who happened to be Indigenous also had one of their children taken and was now a foster parent. So just so that you're aware. Sometimes they apprehend the child for life, meaning until they age out. But a lot of the parents and the caregivers were telling us that they only had interactions with child welfare later. So like when they were older and they had their own kids or their grandkids. We used, Amy and I actually wrote this as a paper too, the Anishinaabe Medicine Wheel, used as a theory evaluation tool and conceptual framework. And so this is just how we looked at the data. We looked from the self, the family, the community, the nation, and all in creation. But we also looked at the 4 dimensions, right? So we were also looking at the physical, the emotional, the spiritual, and the mental aspects of a person and what the data could tell us through all of this. And we came out with these themes. And so we're going to talk about each of these themes in great detail right now, just so you get a sense. And what we're not going to do is we've put people's actual quotes in so that you can see what we were seeing as that theme, but we're going to talk to the issues that we're discussing here, the themes that we've titled them as, if you will. So the cycles of child welfare became really apparent as soon as you start reading through all of the data. There were people that were telling us, like the first one, they're not even 2 years old, they're in child welfare, and now they've had a child and their child is in child welfare. And they can't understand what they did wrong as a parent. Like they grew up in foster care. They have done everything that they were told to do, and yet because they're Indigenous, their child was taken away from them before they even had a chance to figure out what they've done wrong. And some of them will jump through hoops to do all the milestones and indicators that are being expected of them, and this still happens. So the cycle continues. Or some of the parents were telling us that, or the grandparents were telling us they were in residential schools, and then when they had children, their kids went to foster care, and then now that their kids are old enough, their kids are now having child welfare involved in their families' lives. So the fear of child welfare is so significant. There wasn't anybody that wasn't fearful of the call. And in fact, I was just about to say, and Amy has some stories, but in fact, this is like a predominant fear that I think most of the participants had. Go ahead, Amy.
Yes. And so there was two kind of things that I was seeing too, was that there was substance use. Yes, there was that too. Not all the parents were experiencing substance use where their children were apprehended, but also a lot of families that I spoken to were getting apprehended. And one in particular had a disagreement with the father of her child, and that led to apprehension of her child. She was deemed an unfit mother, and she spent years trying to get back her child. And it became such an entangled mess. And that in itself was like she was doing the hoop jumping one right after another. And now she's, a lot of the parents I speak to, even as I began the story about myself being fearful, not because I've interacted, but just hearing these stories day in, day out with Indigenous community members all over Ontario and all over Canada, that is the same narrative that I am hearing. And, when I talk about that openly, parents will come up and share their own experiences of those encounters as well. All right, next slide.
Foster care, I'm going to say just a little bit about this because it was an issue, but it was more about the fact that they couldn't find Indigenous families, and a lot of them were finding families that were, for lack of any other term, racist, and would take it out on the children that they were fostering. And so parents would find out that that was happening, and this caused a whole bunch of things to happen. And foster care was also a place of abuse and trauma. A lot of the participants talked about this, and actually we heard a lot about like really horrid stories about becoming a Crown ward, and that social workers weren't letting families know when they had to go to court, and so then the kids would become Crown wards and end up in foster care until they aged out. So it wasn't like families didn't want the kids. It was more like the system was designed to not allow us to have our kids back.
And also, really quickly on that note, it was also, we don't have a lot of Indigenous foster care homes because the amount of scrutiny that one goes under because of those issues. And then we're not allowed to have these in family adoptions and things, which rightfully so. I understand why those are there, but it also limits who gets to be foster care parents. And I had both parents and grandmas and foster care families share that with me about how difficult it was just to even open up a foster care. She's like, I'm constantly under scrutiny, probably more so than a non-Indigenous family. And that really stuck out to me when she had said that. So I'll give you this next one, Angela.
Yeah. So I call it intra-generational trauma when we're not siblings, we could be cousins, we could be friends, and you had this experience of trauma and you pass it over. So Amy and I are friends, and now if I have a trauma and I tell her about my trauma, she now gets to live my trauma with me, or she's taking something from my trauma, which is similar to intergenerational, but that's coming down the pipe. It's coming from the top down, from one generation to the next. This is more siblings can have it, cousins have it, and friends have it. And the experiences you have are very unique to yourself. So you could be illustrating a trauma to somebody. And that's what we heard from some of these children and parents, was that, and when I say children, they were taken as children, where they were starting to find that, maybe their siblings were taken, but they weren't taken, and that left them with trauma. Others had been taken with their siblings, and then they were trying to find ways to escape together because then they separated siblings when they got to foster care. Like lots of things also caused trauma while they were in the system, not just why they were taken from their families. And that is an important part that I think that we want to highlight, that it doesn't have to be just the experiences we have as individuals, but the system itself can also instill new traumas that we weren't expecting it to. We had a lot of people talk about being in poverty. There was one mom that talked a little bit about the fact that she could only afford a 2-bedroom apartment, which meant that her children who were of different sexes had to share a bedroom. And she was in the smaller bedroom. She'd given them the master bedroom, if you will. And that the social worker didn't find that acceptable and told her that she had to find another place to live. We heard that. We heard, like there's people that were working more than one job trying to make ends meet. Like things that we heard weren't that they weren't trying. They were trying to meet the indicators, the risk indicators, and better it, but they just can't. And then the other thing we were hearing is people at 17 were told, okay, goodbye, see ya later. And Indigenous Services Canada and all of the Indigenous agencies were unsure what to do with them at 17, 18, and they didn't know where to go. So now they're living on the streets, and and then you're starting a new cycle and a new trauma that we haven't even discussed. But these are all things that our participants were talking about and how that affected them when they wanted to have children. Mental health is just as important here as substance use, because we heard often that people were having depression and anxiety. It wasn't just that they had a substance use issue. Looking back at all the trauma they had talked about, it's not surprising to me that people were using coping mechanisms that are clearly not conducive to what they wanted, and couldn't find the proper treatments that they did need. I'm going to kind of leave it there because, as you well know, mental health and substance use can cause way more issues in child welfare. We've already talked a little bit about culture and language. And again, it's all about this idea of having it available. I've talked a little bit about the racism already, so I'm not going to go into this either. Community supports, we heard a lot about the fact that there was there was community supports, but then it depended on where you were. So the location of the community supports was important, or if you had connection back to your family. What I want to say here is just about the fact that we're watching parents who were very resilient. They did all of the things, they jumped through all of the hoops. And now the resistance piece is about advocating for better funding for child welfare and to have our own laws and all of those things, because that's where we need to go. The system has to change. It's not Indigenous people that need to change, but the system has to change. We'd almost argue at this point that we need some kind of national inquiry or national commission, just like they had for the Truth and Reconciliation Commission, to talk about Indigenous child welfare, because it's becoming that much of an issue. Not that it hasn't been, but because it's still that same issue over 60 years, and it shouldn't be that way. We have to rethink the existing structures that we have in place. We have to start looking at how Indigenous people can be self-determining and self-governing. And then we're recommending that there's an increase in training and knowledge of Indigenous family structures across fields. It shouldn't be just for social workers, but rather even healthcare providers who may not understand how we interrelate with each other. And you should be building a lifelong relationship with Indigenous peoples, organizations, and communities, whether it's for child welfare or for health or for education, because it's not you come in and you leave. Relationality is really important for Indigenous people, and it's important we do that. We need increased research in Indigenous child welfare. As we found out, there wasn't enough time and enough money to keep us going, but there's lots to do. And our work is for the children. It's not for us to build our careers off of, but rather trying to make sure that the children are safe. The picture on the right is from Brandon, Manitoba. And that when they went and did the ground penetrating radar. This is the graves that they found. Every heart represents a child in that school year. And I will stop sharing so that we can start answering questions.
Thank you so much. Thanks, Dr. Mashford-Pringle, Dr. Shwanda, for your excellent presentation and for sharing those really difficult stories with us from your participants in this research. We have a few minutes left until the end of the hour. You're welcome to put questions in the chat. I'm happy to read them for you, or you can come off mute, raise your hand, and ask your questions directly to our speakers.
And we recognize this is a heavy topic.
Andy.
I'm just going to stay off camera, but thank you so much for that presentation. I think it's so important. And as hard as it is, it's really great work. I hear a lot of the same stories from people from our advisory group on a project where we're looking at opioid use in pregnancy. So the same fear of child welfare and like such intergenerational trauma from people. I'm curious if through your work and with Indigenous communities having their own child welfare, if you've come across more collaborative models where child welfare is working like with family and community to be able to keep kids and families together.
I think that our Indigenous communities are really, really good at using, they do wraparound services or blanket services so that when mom does give birth to their child, they're able, and they say they are using opioids or whatever it is, they have this proper supports. A lot of them do become clean and some just find like they haven't dealt with the traumas from before, whichever it may be, or their addiction. Full well aware of that. The service providers in communities can easily, because they understand it's not a siloed project, whereas health is, I find our Western structures are very siloed, whereas our Indigenous service sees that interconnection and can quickly make those, and there isn't a barrier. Well, that's their area of mental health and we're not going to go there, or, that's not my area. They work together collaboratively to ensure that parent and especially that child is supported, and they know that those parents and child bond are so important. So they really do work collaboratively in that aspect. I'm not sure about urban space. Maybe Angela can answer that one.
Not as much. And they're still very focused on using the Western risk assessment, and that's causing problems. So I'm imagining in opioid research, the same things happening is they look at harm reduction from a very Western perspective instead of how we would do harm reduction with family on the land. There is an organization in Manitoba where they are now having detox on the land, and you can bring your children. And to me, that's the next phase that we need to see.
Mm-hmm. Great, thank you so much.
Susan, please go ahead.
Yeah, it's fascinating. I think it's a very, very different model from the family systems addressing youth and difficulty among non-Indigenous populations, where emancipating the youth from a family experiencing difficulties is often a priority or a very real option. Have you had any experience with charities or NGOs along the lines of Stepstones for Youth? When you were talking about they're an organization that works with kids who are aging out of foster care, and attending some of their workshops. Some participants from the US looking at racialized populations were gobsmacked at the Canadian statistics on the proportions of Indigenous kids that were affected and families that were affected by foster care. They were gobsmacked on the global stage. Anyway, I'm curious if you've had positive or negative experiences with organizations like that.
From my experience, the only organization that's really stepped to the plate has been Covenant House. Other than our own Indigenous organizations who have all tried their best. We have funding that goes through like training and education. So in Toronto, we have Ms. Beek, and a lot of our youth will go there, but they need to know that it's there, and not everybody knows this stuff. And if you're from the north and the only foster family happens to be in the GTA, or you're from London and they put you in Toronto, like you may not even know organizations, and it depends on when you got fostered and where you came from. So my knowledge right now would say no, we haven't had the greatest success rate with the aging out part. And it's the thing I hear the most frequent from university students, believe it or not.
Thank you.
All right, I don't see any other hands or questions. There was just a question about whether the lecture will be recorded. The answer is yes. It's hosted on the Leong Center YouTube, and you can find the link under Leong Center Rounds on our website. Oh, and we have time for one last question. Aggie?
Hi there. And thanks so much for your presentation, and shout out to Etobicoke. Born and raised. Anyway, we've also been working on a project related to prenatal opioid exposure with 13 First Nations communities in the lower half of Ontario. We're now at the point where we're thinking of working with communities based on what we heard from communities on First Nation centered resources around opioids and pregnancy. And something that's come up time and time again is that fear of apprehension from parents and families, and which is keeping mothers who use opioids during pregnancy or being treated for opioid use disorder from disclosing their opioid use, getting the prenatal care that they need, even, at all stages, and obviously during childbirth and so forth. So when we're thinking of developing these resources, there's a question, for example, in one of the resources from the Society of Obstetricians and Gynecologists of Canada says, will my baby be taken away if I'm honest about my opioid use? And, they say that they cannot be reported if they're taking, opioid substance treatment, and that Child Protective Services are also increasingly supporting women in treatment and so forth. And so, but I'm not sure that we can responsibly say that when we're looking at First Nations audiences. So just wanting to hear some of your guidance around that, and just some general thoughts.
I'm sure both Amy and I have thoughts on this one, but based on my experience, and I've worked in children's programs, federal children's programs, I would say that's an astounding no. Do not tell them that. And it also goes to the fact that while they're going through pregnancy and they're worried, there's nobody calming them down. And so no healthcare professional is going to tell them it's okay, we're helping you get through in the safest way. And so all of a sudden now their fear is, when I go to the delivery room, the birth alert that I just told you was ended is going to show back up again.
Mm-hmm.
And I knew people when I lived in South Etobicoke who would go to Jean Tweed, whether it was for alcohol or narcotics, and they would end up losing their kids. So we have a big problem between what hospital and medical professionals will do and what we know they should be doing, and specifically for Indigenous populations. So I would say I would not, in my opinion, give the advice that they be okay and that the child wouldn't get taken. I would not say that.
Okay, thanks. And it's hard because the community members, like the community staff, want to be there to support them to help keep their families. So there's a lot of tensions in there, but thanks so much. I know that it was a big question to throw at the last minute. So thanks very much.
No, I forgot to count him off of mute. All right, we're at the end of the hour. Thank you all so much for joining us. Thank you again to our excellent speakers, and hope you all have a great rest of your afternoon. Take care.
Thanks, everyone.
Thank you.